Good afternoon, everybody. Welcome to this week's Foundations Live, Tuesday afternoon at 2, and this time all about warm homes and health and housing. So welcome to today's Foundations Live. So this is the Foundations Live that we did hope to do 2 weeks ago, and then the internet went down and we couldn't host it. But really pleased that Adrian and Grania are back with us today. You'll be hearing from Adrian Wright, who's the CEO of Happy Energy, about some of their energy saving approaches in a few minutes' time. And then Grania, who's from the University of Strathclyde, on a really interesting housing and health project that they've been working on. So back with Adrian and Grania soon.
Foundations Live.
So just as usual, a quick run through of introductions and things you need to know. So if you haven't been to a Foundations Live before, welcome. We're the national body for home improvement agencies and the Disabled Facilities Grant in England. And I'm Paul Smith, I'm the director, and we're funded by the Ministry of Housing, Communities and Local Government, which means that we're here to help you with anything home improvement agency or DFG related. If you're looking for closed captions this afternoon and you're watching on the website, if you scroll down the page, you can find the links to LinkedIn, Facebook and YouTube, where we're also streaming this afternoon, and you can find closed captions over there. So thank you for coming back. If you were here last time, thank you for bearing with us. Kind of the Cloudflare outage that downed most of the internet also downed our website. So unfortunately, we couldn't host this one a couple of weeks ago. But what also has happened since, I just wanted to share with you, is that we have updated the Adapt My Home website. So let me just get that shared on the screen with you. There we go. There it is in its glory. New version of Adapt My Home, which is adaptmyhome.org.uk. And if you go to the local authorities tab, which is there, and you scroll down a little bit, you can put in the postcode. So if I put in a random postcode, it comes up with next, and it will tell you the details of the local authority where that postcode is, both in terms of the housing team and for social care, both children's and adults. And there's a little button at the bottom there that says, does that look correct? So if you could do me a favor while we're going through this afternoon, either click yes it is and send it in, or click no and tell us what needs updating, and we'll make sure all the information on the Adapt My Home site is fully up to date for any members of the public looking for any contact information. So I think that's all I was going to say to start with. And so first this afternoon, I'm going to welcome back Adrian from Happy Energy.
Foundations Live.
They are. Welcome, Adrian. Is Dominic joining you as well for the presentation, or is
he's supposed to be here? He was trying to join. I'm not sure if he's.
Yeah, there we go.
There
I'm here.
Excellent. Right, I will pop your presentation up, Adrian, and hand over to you and Dominic to talk us through Healthy Home Grants.
Thank you very much, Paul. First of all, this is the first Foundations Live that I've been to, and I'm suitably impressed by all of the graphics and the music. No presentation that we produce will ever match up to this, so we're going to have to learn how to do that. So very impressive. And the music even says that it's a Tuesday. It's just, I don't know if you've got one for a Wednesday or Thursday, whether you always do it on a Tuesday, but it's all very impressive. So I'm Adrian Wright, Chief Executive of Happy Energy Solutions Limited. We've got Dominic Monroe, who heads up our partnerships, primarily with local authorities and housing associations, who's Essex-based. Just to give you a quick overview about Happy Energy Solutions. So we've been helping people to, with grant-funded energy conservation works for about 30 years, helping them to have a warmer, healthier home, with certain measures like insulation and heating, but also doing some various pieces of work, which I will talk about, around health and dust mites and damp and mold and that sort of thing. We're a principal contractor, which means that we always use a network of local contractors in the area. So we work across, all across England at the moment, but we particularly concentrated in London, the southwest, East Anglia, southeast. So we do a lot of work with local authorities, housing associations on grant-funded works, and some of the schemes that I will talk about. We have been, because we've been around for 30 years, we've got a really good understanding for all of the different grants that are out there. So obviously, you and your organisations have additional grants which are potentially complementary to the grants, and we do a lot of work with DFGs, or trying to stitch work, funding together. So if there's not quite enough funding, or if additional help's required, we've got people that go out and try and ferret around to try and find that additional funding, whether it's from local authority, DFG, Better Care Fund, carbon offset. Sometimes it's from charities. So there's a whole host of different places that we'll go to try and make sure. So it's not just the energy efficiency works. It might be that they need some assistance with hoarding. Perhaps their cooker's broken as well, on top of everything else. So we, through foundations, we've been working with the Gas Save charity, some of that work as well. Because we work with local authorities, HHSRS is sort of quite a big part of what we do. So obviously we're talking here about a lot of the changes in Awaab's law, damp and mould, but we've incorporated, thanks to foundations who gave us training some years ago, all of our assessors will be looking for those risks and hazards while they're in the home. So even though we're there primarily to do an EPC rating and to do a condition report and to look at what insulation works or heating works can be done, we're also looking out for those potential issues that could cause risk to the residents. And we are a foundation's registered home improvement agency under the energy efficiency category. So we've been doing that for a number of years. So keen to work with any local authorities that would like to work with us in their areas to help improve people's homes. So the presentation today is about grant funding for work. So not just damp and mould works, but sort of trying to make the home warmer. When we had the last presentation, when it unfortunately got cancelled because of Cloudflare, this presentation was very different. For those of you that have followed the budget, or may not know about the energy company obligation and Eco4. So I was hoping that in the sort of the couple of weeks break that we'd had since the last session, that actually we'd have some good news, and Eco would be extended, and we'd be able to tell you about the £1.5 billion a year that they were spending, and they were going to continue spending, which is what we were hearing. The mood music was indicating that yes, there'd been some problems with poor quality work in solid wall insulation, as you've probably all seen in the press and on the TV. But actually, it's a scheme that had been running for decades, so it was going to carry on, but it's not. So Rachel Reeves has decided, or Labour have decided, the government have decided that it's going to be cancelled. So it was always going to run out at the end of March 2026 anyway, but they've now decided they're not going to continue it because it was that very smelly Tory scheme, nothing to do with them. So they're getting rid of it. And unfortunately, I think it's now about 1.7 billion a year that's been spent on Eco4 to provide grants for low-income households across Great Britain. That's now been lost. They've put in 1.5 billion, which is not an insignificant amount of money, but they've stretched it out over 4 years. So this year, or 2026-27, that 1.7 billion is now dropped to about 285 million. And we're not even sure that all of that's going to come back into the industry. So I've got a very short slide on Eco4 because it's coming to an end. So I won't go into too much detail. There are still some grants out there. There's been an extension, so Eco4 technically is going to continue all the way through to the end of 2026, but there's no new funding. So it's just really energy companies having a bit of extra time to finish off the last few bits and pieces they need to do and to remediate any of these solid wall insulation works that were poorly completed. So there's very limited funding available. It's unlikely that you're going to be able to recommend any of your clients to be able to access this, but there might still be a bit of funding. The other thing to mention as well, the Eco4, the 1.7 billion a year that the energy companies were supposed to spend, they've actually spent more on that. And because of the way the cost cap was implemented with the energy bills, it's meant they weren't able to recover all that cost through the bills. So the government are going to take some of that money that's been set aside in the Warm Homes Plan and probably pay it over to the poor energy companies who are obviously struggling to pay back the extra money they spent in delivering eco. So we're not overly happy about that, and we're trying to battle to try and keep that money into the fuel poor households. So what funding is there potentially in your area? Some of you will maybe be aware of this, but the big ticket item in town is the Warm Homes grants. So you have the Warm Homes Local Grant, which is what I'm going to talk about, which is private sector housing. And then you have the other scheme, which is bigger, Warm Homes Social Housing Fund. But as it says in the title, that's only for social housing. So this is the only real game in town at the moment for private sector housing. It's awarded directly to local authorities, or it has already been awarded. There's about £500 million over 3 years, again, drop in the ocean compared to eco, which is 1.7 billion a year. That's been allocated out to either individual local authorities. If they're one-off local authorities, they might have got £1 million or a couple of million. If they're a consortium, so we are delivering a Warm Home Local Grant for Essex County Council, for any of you who might be in Essex. And that's 6 million of funding over 3 years. And what that's providing is up to £15,000. So it's quite a good chunk of money. And that's for insulation works, solar works, loft cavity, that sort of thing. But there's also an extra £15,000 if the person needs a heating upgrade. So that could be an air source heat pump or storage heater upgrades where they've already got electric heating. There is a PDF of this slideshow which has links. So you can go through the links and see which local authorities have got which funding. Unfortunately, not every local authority has funding, so it is unfortunately a bit of a postcode lottery. So some residents, which is why eco was great because it covered the whole of Britain, whereas this was targeted. So we're hoping they're going to put more of the 1.5 billion they've set aside into Warm Home Local Grant, which may enable additional local authorities to access funding who missed out on the first round. But this is Warm Home Local Grant really is the main fund that we're going to be talking about. So as I've mentioned, it's sort of pretty much all insulation works, electric heating, solar PV. Now, not every, so it's not really a scheme where residents can come and say, I want to have room and roof insulation. I want to have this. It's they will apply. The managing agent or the local authority who's running it will go and do a survey, and they will decide, in their opinion, with using a retrofit coordinator who oversees the works, which works are going to be right for that home, which are cost effective. They might have particular targets about how many homes they have to hit, average cost they have to achieve. So not necessarily things like solid wall insulation. It's a very expensive measure. It's a high risk measure as well with all of the failures that there've been. So the likelihood is not every scheme is going to offer solid wall insulation. They may be the odd case. Windows is something everyone always wants windows, but generally if the windows are hanging out and need replacing, there's a lot of other disrepair going on. So sometimes there's more funding that needs to be brought to the scheme, which is where potentially you can use your funding to provide that additional funding and maximise that. Specifically in relation to damp and mould, we can, or under Warm Home Local Grant, that is expected that ventilation will be fitted if there's some kind of fabric measure being fitted. And in some other circumstances where the home already has a lot of insulation but doesn't have ventilation. So that will be things like the constant running decentralised mechanical ventilation in the bathroom and kitchen, and a few other things that I'll kind of run through. But importantly, the fund won't fund ventilation on its own. There has to be some additional works going on. It has to be kind of secondary, supplementary to that for it to be able to be funded. But there are opportunities for potentially for the funding that you've got and the funding that Warm Home Local Grant has got to help your funding go further. There are eligibility requirements, which I'll go through in a sec. So who's eligible for Warm Home Local Grant? It's probably the typical household you'd expect. So those that are on an income related benefit, one person in the household, would make the home eligible regardless of the rest of the income of the household. There's a household income only option. So if the gross household income, that's everyone living in the house apart from like a lodger or a student, is below 36,000, then they might be eligible. There's also a list of postcodes which are, you're probably aware of IMD areas, index multiple deprivation. So it's not specifically IMD areas 1 and 2. It's the areas within the index of multiple deprivation that have the lowest incomes, decile 1 and 2. So there's a blue link there. Once you get the PDF, will take you to basically a spreadsheet you download, and it will tell you which postcodes are included. So with that IMD 1 and 2 area, anyone in that area is eligible regardless of income. So it does give you a lot of flexibility for helping people with these type of measures. I've also mentioned here, it's a bit more complicated. So even though eco is going, there's still an opportunity for someone to be referred through on a health route. So in Essex, for example, our scheme is called Heat Essex. And if we decide, or if we see someone that has particular health issues and could really do with receiving the grant, but they're not in the right area, or their income's above 36,000, or they're not on the right benefits, then potentially we can work with the local authority. And this is across the board in any scheme. It might be that citizens' advice say, actually, this person's struggling with their energy bills, and we can say, yeah, and we can see they've got some kind of health issue. So a combination of a couple of different markers may mean that they're eligible. So it's not hard and fast, but generally, if they have an illness or some kind of respiratory disease and a low income, they might be eligible regardless of those other points. Private rental properties are eligible, but landlords can only have one free upgrade. So if they've got multiple properties, once they've had the first one free, they have to fund half of it themselves. And most importantly, the home has to be EPC D or below. So if you've got clients who are in fairly modern gas heated property that's well insulated, chances are that will be EPC C or B, so they won't be eligible. So it's important for you to understand, if you're referring people and signposting people, that it tends to be the slightly older properties. So some gas heated homes are D, but if they're already very well insulated, then the chances are that they might not be eligible. So what do we do in terms of ventilation, which is obviously helpful for improving the health of the residents? So I've mentioned the extractor fans, the mechanical ventilation, and we tend to use the constant running ones because they are the most efficient. They're more expensive, but the scheme will fund that. It is a requirement for the managing agent of the fund or the retrofit coordinator who's overseeing the works to produce a ventilation strategy. So they should be looking at the whole property, what ventilation is required, whether it's within the house, whether it's in the roof space, for example, to stop condensation up in the roof space if you've insulated it. We may need to fit window trickle vents to allow the fresh air to come in to replace the air that's been pulled out by the extractor fan. The air also needs to circulate around the house. So not a popular measure, but sometimes we'll cut a centimetre off the bottom of an internal door to allow that air to circulate. For those of you as old as me who remember the snake or whatever you used to put on the door to stop the draft, we're putting them back in to help that airflow around. And in some cases, we'll do an air pressure test. So that's a whole host of equipment that you put on the property to try and ascertain where the house is leaking. Or either to see if it's leaky enough so it doesn't need all this extra ventilation, or to see if we can find some great big gaping holes behind pipes or something that's actually making the house cold that we can seal up. But again, there's no direct funding within the scheme to tackle the damp and mold. So partnering with organisations like yourself is ideal if you've got funding. So it might be that the damp needs to be cleaned, the property might need to be redecorated. This warm home local grant scheme can kind of help the source of the issue, the damp and the condensation, and warm the house up. But ultimately, tackling that is an issue. And with Awaab's law, obviously there are certain timescales that trigger that need to have these things remediated. Currently in social housing, moving over to other properties as well. So I've mentioned how to access the grants. So this slide deck has various links to the local authorities that have the funding, if those of you don't know. You can point the residents to an online application form. So it's called the Warm Home Local Grant Eligibility Checker. There's a link there on that screen where they'll enter a bit of information. It will look up their EPC. It will give them an indication if they're eligible. Unfortunately, what it doesn't necessarily do is to say, yes, your local authority area, I don't think it does, has some of this funding. So, if they live in a council area that doesn't have the funding, they just can't get it, which is why we believe the government need to do something quick to replace eco, because it's unfair on those people that live in areas that don't have the funding. But any of these Warm Home Local Grants, we're really keen to work with you to see, and you might well be funding your DFG work, or funds might be funding heating, for example, insulation. So why not try and leverage some of this other funding, and then your funding could go further, and also it can be used for potentially different things in the property that are complementary. In London, we did quite a bit of work with a number of local authorities, including Hackney. So we managed their Green Home scheme for quite a long time, and they had their carbon offset funding. So I know that's quite common in London, but not so much outside of London. But that's another opportunity that can be used to tie in with Warm Home Local Grant. One thing, so I mentioned earlier that we sort of been involved in a host of other things. There's a link here to a study that we secured funding for from the Health Action Zone. Any of you remember that? Called A Breath of Fresh Air. We were looking at what could be done to properties. So we were particularly targeting young children that had asthma and what we could do to their home to actually improve their health. And we looked at, can you just insulate the property? Can you just put heating in? Is there like a whole package of different things that you can do? And I just wanted to raise, I'm sure I'm preaching to the converted, but damp and mold is a major issue, and the spores that come off of that are bad. But the spores that come off the dust mite feces, the derpy one I think it's called, they're equally as bad, much worse if depending on which studies you read. But we identified that increasing the ventilation, reducing the relative humidity below 60%, it means that the dust mites can't eat the food, and the food it becomes more difficult for them to eat, so they die off. So tackling that, getting the right temperature, reducing the relative humidity, but also in residence home, trying to get rid of carpets, have hard floors, covers on beds and mattresses, getting rid of the superhighway for dust mites to get from one room to another. If they can crawl across carpets and up pillows and curtains, then the house is going to be just full of these small particles which are causing serious issues. And we're delighted to say there was a pair of twins, age 2, that were going into casualty once a month. And after our ventilation upgrade and the changes we made to their house, they only went in once in the next 12 months. The siblings were having less time off school. So it's, I'd really just like to kind of raise dust mites as another major issue of health, in addition to damp and mold. And that is it. And Dom, I'm not sure if there's anything you particularly wanted to add.
Okay, well, I've been following the chat. So while you've been talking, Adrian, lots of people have been asking questions. So maybe it might be worth picking up on some of those quickly. So there's one about, the schemes for Wales and Scotland might be worth mentioning, and how they differ. And there's also one around gas central heating, and would that preclude people applying, or is it that's okay and literally it's on the EPC rating of D and below?
So thank you for changing the question. So whatever money spent in England, a proportion is allocated to incidentals or something, basically to Scotland and Wales. So Scotland and Wales have their own schemes, own area-based schemes, local authority-driven schemes. So any of the funding that's been made available, a chunk of money, so this 1.5 billion that's been set aside as extra money, with eco being removed, our understanding is that they're taking an element of that for Scotland and Wales, and that's being dumped into their existing schemes. I know in Wales, for example, that you've got Nest and the ORP schemes, And in Scotland, you've got a number of schemes, grant schemes and interest-free loan schemes. So yes, there are definitely schemes, and this extra money that we're talking about, specifically talking about Warm Home Local Grant, which is England, but there are other schemes in the 12 nations, and they will be getting a chunk of money as well. What was the other question? Oh, gas central heating. Yeah, so gas central heating doesn't preclude you from being able to access the grants. It very much depends on the EPC rating. So it might be that you've got a really old non-condensing gas boiler, and it might be that it could be upgraded to an air source heat pump, maybe with some solar PV on the roof as well to help reduce the running costs. In eco currently, so for the next probably till the end of March, there is some funding around, and that will fund first time central heating. So if the house has gas but doesn't have gas central heating, then they can actually have non-condensing boiler to a condensing boiler or a gas central heating system. But Warm Home Local Grant and Warm Home Social Housing Fund, absolutely no fossil fuels allowed in those.
So I mean, I think that's probably going to be a theme for the future, isn't it, Adrian, in terms of people who've got existing gas boilers and kind of struggling with what to do if the boiler breaks, or if it's kind of beyond economic repair.
Yeah, and gas boilers can, I mean, you can get in and replace a gas boiler in half a day. Yeah, they're really quick, they're really easy. Yes, the CO2 emissions and net zero and everything else, but if you're sitting there with no heating and hot water and you want something quick, something like the Warm Home Local Grant, you could be looking 6 to 8 weeks by the time you've got all the surveys done and everything's been produced and the paperwork and the documentation, and then it's an air source heat pump, and maybe you've got a combi boiler, so you don't have a hot water cylinder, so now you've got to find somewhere to put the cylinder. So there are some solutions around that. There are cylinders that go outdoors. We fit one in an outdoor container, an insulated outdoor container, but it's not quick. So there is the dichotomy, unfortunately, of people trying to keep people warm and make that quick, and that's generally when the DFG work will partner up. We'll just say our scheme's not quick enough, but we'll contact the local authority and try and get that funding in.
But I suppose the issue is that if the person isn't disabled, then that wouldn't potentially apply either. So
people get stuck. To care fund. I mean, I suppose it depends on the policy of the individual councillor. Now, some authorities have obviously got a lot of funding and are keen to get rid of it any way they can, and others have got next to none, and they have to be really obviously very strict with how it gets spent.
So there was this question from Kate, who was relatively specific around surveys on listed buildings. Have you got any experience with those?
Yeah, so the under there's something called PAS 2035, which you may or may not have heard of, and these are the new standards that the government introduced to try and ensure that work's done properly, safely. There aren't any unintended consequences, but it's all failed miserably because there's all these solid wall jobs that have been done really badly and no one was checking what they were doing. But within those standards, up until about a year ago, if the house was listed or in a conservation area, you had to do all sorts of extra things, and you had to get architects involved, and you had to do these air pressure tests that I described earlier, were mandatory to do those. So it just added a huge amount of cost. So there was a bit of an automatic, that's in the hard basket, we're not going to do that. But absolutely, listed buildings and properties in the conservation area can be included. We in Essex will be working on those properties. We've got a big waiting list, so we'll be kind of doing some of the easy ones first because we've got annual targets to hit. But then we will be taking the time. There's budgets available to help with those architectural costs, the planning permission, but it does all take time. But things like conservation area, for example, you can still have solar in those areas as long as you don't put it on the front wall. Heat pumps can still go in. There's all sorts of things that can be done, but it just depends. If the managing agent has been a little bit stubborn and don't want to put the effort in, but I'd potentially challenge it, because they are 100% eligible. But they're right, they will need to have some planning consent obtained, and there should be funding in the enabling budget for that to happen.
Great, thanks, Adrian. Another one here from Martin. Do people need a formal diagnosis to access funding via the Flex Route 2 health option?
So there's a range of, so I can drop a link into the chat, or maybe Dom could do that. I have got the document open actually in the background because I was looking at it earlier. So there's a list of health conditions that fall into the NICE. So it's basically the NICE guidance for sort of low income, vulnerable to the cold. But within the eco guidance, which is the guidance that's used for this, it can be things like age as well. I think it's over 65, a child under 5, things like the respiratory conditions. There's a range. So it might be that you can have a hospital letter that references that it's an asthma clinic, or the asthma nurse has come around. It could be we do have a GP service that we've teamed up with, so we can get them to check the evidence, and then they can sign it off. The person's GP can sign a declaration. There's a whole range of ways of doing it, but it doesn't have to be necessarily a formal, any kind of evidence would be able to be put forward. But in the EcoFlex 2 route, as it's known, there have to be two things. So it might be that they've got that illness, and maybe they've got energy debts, and the Citizens Advice have referred them for support. It could be they've got council tax reduction. It might be that their child is getting free school meals. So there's a whole category of different things that might make them eligible, and we'll try and drop some of that guidance in the chat. But if someone has a specific question they want to email me, my email address is it's just adrian@happyenergy.co.uk. So happy to just ping a quick response back.
Thanks, Adrian. Two more, and then we'll let you go. But there's one here from Wendy. I suppose about oil-powered central heating, whether you kind of think it's worth looking to change fuel source if that breaks down.
Yeah, definitely with oil. I would recommend, because of the not only the carbon emissions, but there are various issues around the cost of filling a fuel tank. You have to have quite a bit of money to be able to fill a fuel tank, and the price can vary all over the place. So where generally under the Warm Home Local Grant Scheme, we would recommend that you swap out an oil boiler for an air source heat pump alongside solar PV. So you've got the solar PV generating the electric to help cover to help reduce your electric bill. And then you've got your air source heat pump, which should be easily cheaper to run than the oil central heating. And generally, if you've got an oil boiler, you're likely to have a hot water cylinder. Not always. You do have combi boilers there as well. But yeah, any Warm Home Local Grant, I'd be surprised if they didn't recommend swapping out an oil boiler, unless it's like my wife, who loves her oil boiler, and it's condensed oil boiler, and she'll just can't get her to change from that. So some people just do love their heating, even people that have coal fires. Sometimes they're really resistant to actually get rid of them. But yeah, I'd definitely recommend changing to a heat pump.
And a last one about double glazing. Can that be included within the Warm Home Local Grant?
So if you look at the guidance, it's an eligible measure. Anything that will increase the SAP rating of a property technically is an eligible measure, as long as it's not fossil fuel driven boiler. The problem is it's the cost effectiveness. So lots of people, everyone wants new windows because it's nice. It makes the house look nicer. Quite often, even if they've got double glazing, maybe they've got failed units, so putting new double glazing in doesn't really save very much. So the cost, so it might be, I don't know, £3,000 or £4,000 that you've got to pay, but the actual bill saving might be £30 to £40 a year. It's tiny. So generally, it's not seen as a very cost-effective measure. We had a live example applied to our own scheme. I mentioned earlier about windows falling out, and literally the windows are falling out. The plants were growing in through the house. If we didn't want to touch it because the house was in a real state of disrepair. So if the windows are that bad, then it's unlikely they're going to be covered. They generally do a lot of it under the Warm Home Social Housing Fund because the social landlords have to replace them anyway. So being able to get half of it funded by the government scheme, they're putting windows in left, right, and centre. But in the private sector, it's hard to get people with the right certifications that you need under PAS 2035 to fit them, and also they're just not really cost effective. You'd be better off putting solar PV in, because then they can, they'll be getting several £100s off their bill instead of 30 or 40 quid. Great.
Thank you for that fairly deep and in-depth tour in the end, wasn't it? I think we covered a lot of ground there, and had a lot of questions from the audience, which is fantastic. So thank you, Adrian. Thank you, Dominic. I'm sure we'll be asking you back for an update as and when, I suppose, kind of further details emerge of what might happen.
Yes, just on that point. Sorry, yeah. The warm home plan is long overdue, that the government are going to be publishing, and we're told, the word on the street is that it's going to come out on the 17th. So next week we should have a bit more information about how this money's been spent and divvied up. I would just like to end by apologising to our Welsh and Scottish friends for not including their schemes in this presentation. I'll hang my head in shame.
I suppose we are the national body for England. Although we'd love to cover other areas as well. But thank you, Adrian and Dominic.
Thanks, Paul. Thanks for inviting us on.
Really appreciate it. Thank you.
Cheers.
Foundations Live.
Right. So that was all your annual guide through the various different funding streams that are available for cold homes, warm homes, somewhere in between homes, and certainly if gas breaks down or gas appliance breaks down, I think that's definitely getting more difficult. Although I did speak to somebody about some additional funding this morning, so I will be in touch with some people about that in the next couple of weeks. But let's move on to our next presentation for the day.
Foundations Live.
So welcome back, Gráinne, from University of Strathclyde, and I'll pop your slides up and get back to the start. There we go. And hand over to you to tell us about the workshop that you had fairly recently.
Thank you very much. So my name is Gráinne McGill. I am a lecturer and Chancellor's Fellow at the Department of Architecture at the University of Strathclyde. So I'll be presenting a little bit of the Scottish perspective on this. Today I will be providing a short presentation presenting some of the initial insights that we gained from a cross-sector workshop that we held at the university back in August this year. Which was focusing on strengthening the links between the home health and healthcare pathways. Let's see. Okay, so this workshop, it was part of a project that we're running from now for the next 2 years on home health and patient health. So it's well recognised that the home is one of the strongest determinants of health, and yet the home environment is actually still really rarely considered systematically within clinical settings. So healthcare professionals are trained to ask a number of different questions relating to things like smoking and diet and other lifestyle factors, but family or things like housing history and housing conditions are still not routinely considered by medical training or routine practice. And this is even when environmental conditions may actually be directly contributing to the symptoms that are being treated. So there's a GP that we would work with regularly would say things like that he'd be treating patients within a GP setting within a clinic, but he has no idea of what he's actually sending those patients home to. And this gap is actually really significant in the current landscape. So there's much more care now shifting into community settings, and it creates real opportunities to actually recognise housing related health risks earlier. So that'll be through things like home visits, community nursing, or even through routine GP consultations. So the focus of this project is actually about trying to bring greater attention to the home and how home is considered within GP and community-based care. Offering a real kind of opportunity for earlier preventative action. Okay, so just to set the wider context for this project, it's part of a much wider program called Design Hopes, which is a transdisciplinary initiative that uses design-led thinking to address complex system-level challenges across health and social care. So the core aim of this wider programme is actually to explore how design-based thinking and design methods could support Scotland's transition to a much more sustainable, integrated net zero models of care. This particular project is part of Pillar 3. The project builds on earlier work that was conducted, which included things like a scoping review and a public exhibition, which was held in a hospital. Examining how healthcare professionals and trying to gain feedback from healthcare professionals of how they perceive patient energy use and the links between energy in the home environment and health. And this next stage, which will be running between October this year for the next 2 years, is just looking at this much deeper into this gap with a focus much more on impact and engagement. And it's seeking to understand how healthcare professionals perceive and respond to the home as a determinant of health, and to identify what kinds of support would help. So whether that's through referral pathways, better screening tools, or targeted training to better integrate the home environment much more routinely into everyday healthcare practice. So the aim of this workshop then, and the aim of this part of the project, is to help to develop a practical screening tool that allows housing related risks to be recognised much earlier and acted upon more consistently across the wide range of different services, which is what really led to the workshop that we held, which I'll discuss next. Okay, so the workshop was held back in August this year at the University of Strathclyde. It was an in-person workshop held over half of a day, which brought together 9 different participants representing a range of a mix of different housing professionals, public health officers, third sector leads, and some academic researchers. And it was structured around 3 key interlinked activities. So the first stage, we initially had developed a range of different indicators on the home environment and health, which spanned 5 key domains, including physical environment, accessibility, overcrowding and safety, energy and fuel poverty, and psychosocial well-being. And that initial exercise then looked at these indicators that we had developed in more detail and invited focused reflection on the relevance, the clarity, and the feasibility of those indicators. Then the second stage was a group collaboration. So in small mixed professional groups, participants discussed different variations to an assessment protocol based on different types of roles within the environment. So from GPs to occupational therapists to housing officers, and how they might all adopt this kind of screening tool differently and how it would actually be used in practice. And then the final activity explored more related to things like gaps and potential refinements of any kind of home assessment framework. Okay, so some of the kind of key outcomes or findings that we had identified from the workshop. The first message was really clear, that the indicators that we had initially identified on their own were not really considered enough. Participants really strongly emphasized the importance of having some kind of a pre-screening stage to try to capture broader contextual factors that could shape how people actually experience their homes. So things like poverty, trauma histories, isolation, or even care and responsibilities, and these elements were really seen as essential to ensure that any kind of a screening tool would be used in an equitable and safe way. The second theme then was on the need for a much more holistic way of understanding the home. So participants questioned the very framing of the home, whether any kind of like a home screening tool should also include communal areas, outdoor spaces, garden areas, or aspects of the surrounding environment. And they also stressed the need for that the indicators themselves are actually deeply interconnected and linked in practice. Another important point was the recognition of invisible or seasonal risks. So for example, winter moisture loads that could be missed if the assessment was conducted at other times of the year. The third theme then was much more around solution-focused design, so centered on how the tool would actually be genuinely usable in practice. So participants were really clear that actually identifying problems through any kind of a home screening tool without providing solutions could risk overwhelming households or professionals. So that was really clear, the need for up-to-date referral pathways and accessible support directories linked to any kind of a tool. And this was highlighted during the workshop as currently a major gap within the system. The need for shared protocols and cross-sector standards also came through really strongly, so that whichever professional actually would use the tool, the information is acted upon consistently and followed up appropriately. Participants noted significant data gaps, particularly around what actually happens after referrals are made, and called for better outcome tracking to support evaluation and refinement. Finally, there was agreement that any kind of tool must align with any existing and emerging frameworks, so things like Awaab's law, so that it can be actually embedded meaningfully into practice and become, rather than actually becoming what would be perceived as an additional burden. So overall, participants saw the tool not just as a checklist, but as an opportunity to actually build much more contextualized, holistic, and actionable approach to home health assessment across different types of sectors. Okay. Then finally, actually looking at real world use, there was, in terms of the tailored formats, the second activity focused on how the tool will actually function in real world settings and what would actually be required for professionals to use any kind of a screening tool in practice. A really strong theme that emerged was the need for tailored formats. So rather than a single universal version, participants envisioned that the tool would be used by a wide range of different roles, and given that kind of a diversity, they were clear that the tool must be adaptable for different workflows and different types of responsibilities. So, for example, a GP might only need a kind of brief triage checklist linked to referral routes, whereas an OT or support worker might require a much more detailed assessment or have the capability to do a much more detailed assessment of the home environment. Alongside formatting, participants identified several enablers that would be essential for implementation, which included things like the need for clear training and guidance, other technical enablers such as app-based walkthroughs, pre-consultation tablet forms. So for example, a pre-consultation for a GP where patients could complete a form in the waiting area, or virtual inspection options were also suggested, allowing data to be gathered much more consistently across different types of settings. The final set of insights focused much more on data linkage and system integration. Participants stressed that the tool should connect with existing systems, so things like existing GP software, housing data sets, or local authority case management tools to avoid duplication and reduce workload. Secure linkage was seen as a really important for sharing information appropriately across different sectors. Finally, participants reiterated the need for shared referral pathways and cross-sector protocols. So it was highlighted that without really clear routes for action, so who does what, when, and how, that the tool would risk identifying problems that then end up falling between services. Then in the very final session, the discussion shifted much more from the tool itself to the wider system that would be needed to support it. So participants emphasised that the tool has the potential to act as a real lever for transforming how housing is actually valued within health and social care systems. So in terms of the key drivers, what was highlighted was that firstly, that the tool could actually help to reposition housing as a core component of health rather than an adjacent issue. Secondly, by linking housing conditions to health outcomes, that this kind of a tool could really help to enable services to model the longer term benefits of early intervention. And third, a data enabled approach could really help to underpin an economic case for upstream prevention, supporting investment in housing from across health and social care budgets, not only from the housing sector. So in terms then of system transformation, to realise that kind of potential, the system really needs to be ready to absorb and act on the insights that are actually produced. Participants stressed the need for established infrastructure, particularly things like funded referral pathways, clear lines of responsibility, and integration with existing digital systems. And without these, identifying problems could risk creating ethical dilemmas for practitioners. Cross-sector collaboration was seen as essential, requiring a culture and political commitment to joint work, and participants noted that the tool would be most effective embedded within procurement and policy or service agreements, and that might help to improve uptake in practice. Finally, in terms of adaptability, the adaptability was viewed as really, really crucial for long-term sustainability. So participants emphasised that the tool must remain people-centred, reflecting lived experiences and human narratives rather than only physical building conditions. It was recommended to have some kind of like a standardised core screening structure with them adaptable sections tailored to different types of roles or settings or levels of expertise, and that the overall system must support both crisis response and early intervention, ensuring that any of the kind of insights from a home screening tool could be acted upon across the full spectrum of need. So together, these kind of insights pointed to a wider ambition, so that if a home screening tool was implemented well, that it could really help to support a shift away from reactive kind of siloed responses towards a much more integrated prevention focused model of care. Okay, so that was just initial overview of some of the key findings that were gained from the workshop. So this project will be running for the next 2 years. As we move to the next phase, which is much more focused on impact and engagement, we're planning a series of different activities to try to deepen the evidence base and kind of look at co-design of practical solutions going forward. So we're currently preparing a short survey that we're hoping to circulate across different NHS boards and primary care practices in Scotland. And the aim of this would be just to capture baseline perceptions of the home as a determinant of health and current barriers, and where practitioners feel clear pathways or tools would be most needed. I'm particularly interested in how healthcare professionals actually perceive their remit in terms of providing advice on the home environment. We're also planning on undertaking 2 scoping reviews. The first one looking at any existing referral pathways that are used by healthcare practitioners based in the UK and internationally, and then also another looking at reviewing existing home health related screening tools and assessment methods. Alongside this, we plan to carry out some interviews and focus groups with healthcare professionals along with diaries to try to gain just a bit more insight into how and when housing related issues actually arise during GP consultations. And then towards later phases of the project, we would hope to organise a larger cross-sector kind of co-design workshop, trying to bring together different players from housing, energy, health and third sector partners to try to refine the design of a screening tool or pathway, and hopefully pilot some kind of a version for a real world setting. This is still kind of in development. We've just really kicked off this initial phase, so we're still really refining what these next 2 years are going to look like. And just before I finish, I also just wanted to mention a really short survey that we're currently circulating as part of a new NIHR proposal that we're developing, which is looking at the impact of household ventilation on respiratory health of children under the age of 5. The focus is in Scotland, but if it was funded within the first few years of the project, we'd hope to look at the feasibility of actually expanding that throughout the whole of the UK. So if there are any housing providers or local authorities in the call, that particularly if anyone has housing stock in Scotland, if you'd be happy to take part in the survey. What we're really hoping to do as part of the survey is actually to just gain an understanding of what data is currently being collected on ventilation provision, and to look at the feasibility of linking that with national healthcare data to look at the links between household ventilation and health outcomes. So yeah, really interested if anyone would be open to supporting as a project partner. Would be really happy to follow up. Okay, so thank you very much. I just wanted to acknowledge the wider project team that is working on this project, including Professor Sonia Oliveira, who's the project lead, and also very much to the workshop participants who helped to share their kind of insight and experience during the workshop. And really interested if anyone has any ideas or reflections, or anyone interested in contributing to the next stages of the research, or any future workshops. I'd be really happy to hear from you. My email address is there. Thank you very much.
Great. Thank you, Grania. It's kind of when you're going to the workshops, was there anything that surprised you or anything that you didn't kind of expect going into it?
Yeah, I was surprised actually with, well, the different perspectives from healthcare providers to the housing officers, and how fragmented the current system is. And I think that is something that there really is quite a siloed approach to the provision of housing, and then the kind of provision of healthcare, even though they are so interlinked and they have such a significant impact on each other. It was quite shocking just to see how even the systems and what we thought initially envisioned the linkage between housing and health, particularly in terms of like systems and how data could be shared, that's much more complex and challenging in practice. And it's something that maybe through the project it would be interesting to explore just how data could be shared more freely between housing providers and healthcare providers to have a better understanding of the impact of housing on health.
Yeah, data, I think is a minefield, isn't it? I mean, not just not just kind of interoperability of systems, but when you throw in GDPR as well, it becomes really problematic, doesn't it? To kind of share information.
We have a funded PhD scholarship that we're advertising at the moment, which we are working. It's part of a wider Centre for Doctoral Training, which is on energy efficient indoor climate control for optimised health. But as part of that Centre for Doctoral Training, we're working, so we're within the Department of Architecture, but we're working with colleagues from psychology and from our computer and information science department. And yeah, that was one of the reasons why we were particularly interested in collaborating, is that ability to understand the whole data and data science and how to link different data sets, and that scholarship would be kind of co-supervised with our computer and information science department to try to understand how to actually do that feasibly.
Yeah, need somebody very clever to do that, I think. And I think you kind of touched on there as well. I think if you, I suppose, kind of, you can tend to think that housing is one joined up sector and the NHS is one joined up thing. That could then link the two together. But I think you quite often find that there's different bits of the NHS all work in their own little silos, and there's little bits of housing all work in their own little silos. So it's quite difficult to find the bits that join together easily.
Yeah, and even within architecture practice as well, it's amazing how the impact of the design of buildings and how little that's actually considered. The impact on health is considered within architectural training and practice. And post-occupancy evaluation tends to be quite a small element of that.
Yeah, I know there's a study going on at University of Stirling around kind of the stigma of adaptations, which again kind of is looking at similar issues. Just had a question pop through from Martin about the kind of outcome impact evaluation period, and I suppose kind of whether 2 years gives you enough time to get kind of purposeful outcomes from that.
Yeah, so the 2 years, it's kind of more focused. So in terms of impact and evaluation, it's the first phase was meant to be kind of much more focused on the research and data gathering. We're still finding that there's still quite a lot of data and a little bit of research that still needs to be done in order to develop a screening tool. So the first phase will really just be about developing a pilot, and that might be such a small element. What we realized from the workshop is trying to develop a tool that encompasses all aspects of the home environment that could have an impact on health is quite a significant undertaking, and that we might be better to just focus on particular areas, whether that's the elements of the home environment that have an impact on things like respiratory health or something, that focus on that and developing a much more tailored part of the tool just to look at those linkages and referral mechanisms and data linkages and pathways in more detail, and that might be much more feasible within a 2-year project.
So
But
were
even,
those, oh,
sorry?
so I was going to say, were those the priorities that came at the workshop? Was that kind of where it was leading you towards?
Yeah, and also like what the project is particularly interested is understanding healthcare professionals' perceptions of the home environment, because what we've found through the initial phase is that while healthcare professionals understand and recognise that the home is fundamental, is one of the key determinants of health, the remit or their perception of their remit as a healthcare provider, well, it depends on the GPs, for instance, or some of the hospital staff through that initial exhibition. It was very clear that they felt like their remit didn't really extend to the home environment, and their ability to influence the home environment was quite limited. So that's something that we're interested in exploring in a little bit more detail, is whether there might be opportunities for training or for some sort of a screening tool to be used by GPs to help better understand the impact of the home environment on the health outcomes, and how home improvements might help to also improve particular symptoms.
Okay. Yes. Yeah. Makes sense. So, do you want to give a final plug for how people can help you with the next stage of the project?
Yeah. Well, if anyone is interested, particularly, so we've got the NIHR proposal that we're developing at the moment, and that's looking. Well, what we're interested with that is how household ventilation, because that can have an impact on health of children under the age of 5. And the reason why we're focusing on children under the age of 5 is mainly because of their vulnerability. They spend a lot more time in the home environment, but then also because we, as part of the project, we would have access to larger national health data across Scotland of respiratory health outcomes of children under the age of 5. So that would be a really, really unique opportunity to be able to link that at scale, to have much better understanding of the impact of not only ventilation provision, but also performance in practice, because we know that provision doesn't always necessarily mean that that's the way the home performs. So any local authorities or housing providers that have data on ventilation interested in contributing, I've got a link to the survey, but if you are happy to even contact me directly. And then, yeah, if anyone is interested in maybe taking part in any follow-up workshops and maybe join a mailing list, that would be fantastic.
Great, thank you. There's a couple of people on the chat there that kind of Callie in West Sussex. They've got a home audit assessment tool, and Adrian saying that it sounds very similar to their own breath of fresh air study. So
yeah, I can't wait to actually look at Adrian's study.
I think that's kind of one of the benefits of doing these things. It kind of allows people who've never met before to share and compare ideas and thinking. So thank you very much for joining us today, Grania, and thank you for coming back again after our full start 2 weeks ago. When would be a good time to kind of catch up with you again and kind of see what's emerged from the next stage of the study?
Well, maybe once we have rolled out the survey with healthcare providers and we've got some data for that, we'd be happy to share some of those findings.
Great. Well, thank you for joining us again today, and I'm sure people will be in touch via the email you've shared. So, thank you.
Fantastic. Thank you very much.
Foundations Live.
Right. Thank you all for joining us today. Thank you for Adrian and Grania for joining us as well, and particularly for coming back, as we had kind of a full start 2 weeks ago. So this is our last Foundations Live of the year. So thank you all for joining us over the many Foundations Lives that we've done this year. I think we've had our biggest audience this year since back in the days of COVID, when nobody had anything else to do on a Tuesday afternoon. So thank you to everyone who's joined us this year. We're currently putting together the program of Foundations Lives for 2026. Early in the new year, we'll be having a session on the new DFG quality mark that we'll be introducing, and thinking about doing one on demystifying the means test. So those probably be very early in 2026. As usual, after this episode's finished, you'll get an email asking for your feedback. You can then claim your CPD certificate and leave any comments. Tell us what you thought. And I think it just ends with me to wish everybody a very Merry Christmas, Happy New Year. If I'm seeing any of you at the Healthy Housing Awards next week, look forward to seeing you there, maybe presenting you with a trophy. But let's end with a bit of Santa on a Stair Lift, our Christmas charity single for this year. So best wishes, everybody. See you in 2026.
Santa's getting older, the stairs are hard to climb. Mrs. Claus said kindly, it happens over time. The elves brought out their toolkits, they worked with festive cheer. Now Santa's gliding upward, the best gift of the year. Santa goes up on a stair lift, up the stairs he goes. Santa goes up on a stair lift, waving as he goes. Santa goes up on a stair lift, laughing soft and low. Santa goes up on a stair lift, ho, 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 ho. They fitted ramps for reindeer and rails along the wall. A brighter light for bedtime, no risk of slips at all. The shower's safe and steady, the kitchen neat and wide. Now Santa's home is cozy with Christmas joy inside. Santa goes up on a stair lift, up the stairs he goes. Santa goes up on a stair lift, waving as he goes. Santa goes up on a stair lift, laughing soft and low. Santa goes up on a stair lift, ho, ho, ho. Now Santa tells the children and families young and old, a safer home's a treasure, more precious far than gold. With grants and help around us, we'll share the gifts we know, so everyone feels welcome when Christmas candles glow. Time moves on, but love will stay. Homes feel safe on Christmas Day. Santa goes up on a stair lift, up the stairs he goes. Santa goes up on a stair lift, waving as he goes. Santa goes up on a stair lift, laughing soft and low. Santa goes up on a stair lift, ho, 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 ho. Santa goes up on a stair lift, up the stairs he goes. Santa goes up on a stair lift, waving as he goes. Santa goes up on a stair lift, laughing soft and low.